It's 10:37 in the morning, and welcome to Tuesday. Your Healthcare Partners, brought to you by GRMC, where patients are partners, and we've got repeat guests in the studio this morning. We're so happy to get them back in here. It's hard to keep you guys away, or you know what I mean, because the work that you do over at GRMC, it warrants follow-up and it warrants repeating. So let me introduce to you lead patient educator Dr. Melliza Young and Erica Taijeron, the patient educator. Hey, ladies, good morning.
Good morning.
Thank you for coming back. It's nice to have you here. The last time we talked about all sorts of different topics. I mean, there's a large spectrum when it comes to patient education, right. and you guys seem to break it down into these nice little capsules and deal with a number of different topics. Do you want to just sort of go through maybe just the areas, points of concentration, points of focus?
So like what we mentioned the last time we were here is that we focus on providing health information to patients and their families to be able to help them, make the right decisions for their health. And so it goes by with all the patients coming and admitted to the hospital, as well as those being referred from the outpatient clinics, whether it's from the specialty clinic or from, clinics from primary care. And so aside from doing this one-to-one teaching with patients, like what you mentioned, we have like a spectrum of these other services that we offer, because we want it to be like an entire package of teaching to cater to patients who are who prefer a different type of learning. So we have print materials, we also have education videos, and if you're the type who would like to learn in a group setting, we also have the group classes.
Okay, so individually with patient educators like yourself, you tackle these different topics and have a lot of one-to-one. Yeah, you want to explain your job? Go ahead, get into that, Mike. Come on, you're a pro. You've been here before. You know how this works.
Okay, so, I'm sorry,
just your areas of concentration, your area of focus.
Oh, okay.
Yeah.
So, like I mentioned, we do group classes, and so we facilitate those group classes. And so a few of the classes that we do provide for our patients and their families, and as well as the community, is we have the tobacco cessation class, which will be coming up in January. One of our newer classes, and we've had that in the past. One of the newer classes that will be coming up as well would be our breastfeeding, and then and also our chronic condition self-management class.
Can anybody come to these classes, or do they have to actually be a patient of GRMC?
Actually, anyone is provided to the community. So inpatient, their families, and anyone interested in any of our classes.
Okay. We spent a lot of time, I think, on tobacco cessation. We talked a lot about some of the triggers, and we also went through a Great American Smokeout since that time as well. In your support of that particular event, was it easier? Was it harder? Was it? Did you get enough people to sign on? What was the general response to that?
Well, with our classes, it is really difficult to get people to participate.
Yeah.
And, a lot of them, I think they're really interested. It could have been maybe the time the time that the classes is given. But then we do try to encourage them that if they can't make it, that we're more than accommodating, and they can actually walk into our office and we could sit with them, and then that's another way that they could participate in our classes.
So any of the programs under patient education, are they developed as you see the need arise? And how do you determine? Yeah, I mean, you could have a program for everything, but right. Because there's a lot of need. Any of these needs that were unforeseen that you thought, we didn't maybe realize there might have been this trend?
So most of our classes are, I would consider it as a collaboration with public health. So we know that our community, there is an epidemic of chronic conditions, and we want to be able to address that, before the onset of that chronic conditions. We know the risk factors, and then when they already develop their chronic conditions, so we try to help them quit smoking or take better enhance their self-management skills using these classes. And so really the need is to be able to focus on the primary prevention, meaning before they even get the disease, and how they can avoid having the complications while they already have the disease. And so breastfeeding is our newest class, and it will actually be led by our lactation consultant. And but we don't stop there. I mean, we're a new program. We just started when the hospital opened. And, again, these classes are in collaboration with public health. And so we continue to gather feedback from patients on what is it that would be helpful for them. And because, again, we want to be able to cater to, the needs of our community, whether it's going to be something that's culturally sensitive or something that really tapers or that's tailored to, a specific population that we would want to.
Okay. Did you want to add to that? Oh, because you leaned in. It looked like you were having a moment. But the curriculum, is that based on public health programs, or is the curriculum formed by you? You're just another asset of the program.
That would be I would say yes.
Okay.
So for example, with the tobacco cessation class, so we were trained by the tobacco cessation specialist on the island. So there's one from the Naval Hospital, and there's also one tobacco cessation specialist from behavioral health. So we all speak the same language in terms of, rolling out these classes so that we don't, again, confuse people on, we're saying, so one group conducting tobacco cessation saying one thing, and then we're saying...
You mean like methodology?
Yes.
The strategy?
We stick to the same curriculum, so we sort of like speak the same language.
Mm-hmm.
And then same thing for the chronic disease self-management. So this one, this was originally created under Stanford University. So this is an evidence-based program. It's 6 weeks, and it's been tried and tested in many states, even outside of the U.S. So other European countries and even other Asian countries also use this program.
Oh, so it's like it's a global approach to this. Oh, I didn't even know that. I wouldn't have even thought about that. You all have to speak the same language.
Yeah.
Okay, you all try to influence them and support them using the same sort of words.
Yeah.
Okay, I get. There's another language there.
Yeah.
The program that's coming up in the new year this is to help women who are having complications with breastfeeding, or is it just breastfeeding education?
It is just a breastfeeding education.
Okay.
So it's like breastfeeding 101, and also how to, encourage moms on, breastfeeding.
Yeah.
Mm-hmm.
Who's doing that class?
It's our lactation consultant. Her name is Laura Shields.
Oh, okay.
So she'll start that. So every third Wednesday of the month from 5:30 to 6:30. So it starts January 10.
Okay. That's got to be one of those issues that it's so weird, because who knew that breastfeeding would even be a controversial topic to the point where it's even become political, where there are lawmakers that are crafting legislation to protect the rights of mothers to nurse their babies in public. And then we have to deal with the social issue of the shame of a mother who needs to feed her child in a public place and, resorts to hiding in a bathroom stall in order to do that. This is it's more complicated, because now if you were having a hard time, you have the desire, you didn't know how, but you wanted to do that, you're also having to deal with these other societal pressures about it, which is unfortunate, because, 9/10 of us could care less. About breastfeeding their child and having to defend yourself while doing it. Anyway, I got a little too political for that one. But it burns me, that's why. So Sheila feels she come in before she talks to, we could commiserate or something. But anyway, you've got a whole line of, I'm pretty sure you've got a whole line of issues that are just in the wings waiting for your attention in the new year. I didn't realize how closely you worked with public health, so that says a lot, because you don't necessarily just have to be a GRMC patient to avail yourselves of these programs. All right. So is there anything that you want us to know, like where people can call you if they need, because you've talked a lot about the ability to respond when people have a need, emergent need.
Well, for
and patients, we really encourage them to, while they're there, to sign up.
Mhm.
And we usually try and get a good contact number so that we could follow up with them and just kind of remind them and try and push them to attend our classes as well as their families so that they can have a really good support group. And then also, if they're not patient, then they could actually just call our office.
Okay, what's the number? And can you be contacted on your website, your regular website?
We're working on it.
Okay, you're
Yes.
building that part of it. Well, like you said, you're relatively new, so it takes some time to build the momentum, and we're happy to help you do that. So, what's the phone number to call?
So they can call our direct line. So that's 645-5688.
Okay, and is there anybody they should ask for, or just is there like somebody who's an intake person, or whoever answers the phone at this point?
No, they can just say they're interested to sign up for the class,
Okay.
and we'll be more than happy to.
Is there a charge for that, by the way?
No, absolutely no charge.
Okay, but you also have to offer materials and
Yes.
others, right, supporting stuff. How do you do that?
Again, it's a collaboration between our hospital and with public health.
Okay, so there's government funding there, even federal funding for that
Right.
matter. Okay, great. Well, thanks a lot for coming back. I appreciate that you guys. What happened to Janice? She didn't like us last time, or?
She had to attend one of our meetings.
Oh, okay. Well, someone had to go and take notes. All right. I appreciate it, ladies. Thank you so much for coming in, and Merry Christmas, a Happy New Year until we see you again next year. All right. Appreciate that.
Merry Christmas to you too.
Absolutely. Thank you very much. Your health care partners brought to you by GRMC, where patients are partners.